I think throughout rural America, there are many, many individuals and families that fall between the cracks. They just don't have the adequate income to take care of the physician bills.
Kentucky, bluegrass country. In small towns scattered throughout the state, 1 in 5 people fall below the poverty line. Without insurance, access to private health care is limited, and there are few public hospitals and clinics for the needy. So when families like the Martins need to see a doctor, they are forced to pay for it any way they can. A job accident forced Roger Martin out of work. Without a steady paycheck, his wife Cherie treated fevers and coughs with over-the-counter medication. But her son Nathan developed a cold that soon escalated into a crisis.
The infection that would set up in his ears, would cause him to run, 104, 105 degree fevers. This was a reoccurring thing. This isn't something that happened in a week. This happened over a period of months.
A local pediatrician insisted that Nathan have ear, nose, and throat surgery. But when Cherie brought him to the hospital, the attending physician refused to perform an operation.
He wasn't guaranteed his money. He refused to do that. So I said, well, what am I going to do? Where am I going to go from here? He said, well, I don't know, but I require $5,000 up front. That is. So I was I was devastated. I mean, I didn't know where to go.
WSIB with the Judds and Why Not Me?
With her son's health at risk, Cherie applied for state assistance. But her income was slightly over the $12,000 Medicaid limit, and she was turned down.
I mean, I was getting desperate, I was getting to the point, right to my congressman, it can't hurt. But they were unable to help me. It was a dead end everywhere I went. So there was only one thing left to do, and that was to try to raise the money myself.
Cherie went to local stores asking strangers for help, but finally, out of desperation, she went public. The local newspaper agreed to print an appeal for help.
When you have to let the public know that you have a crisis and that you're helpless, I mean, that's basically how I felt. It's not an easy thing to do. And in a way, it's a humiliating thing.
Cherie finally raised enough money for her son's operation. But without health insurance, she, like 40 million Americans, fall through the cracks. They earn too much money to qualify for Medicaid, but not enough to pay for medical services. Many rural Americans don't have the transportation to get to public hospitals or clinics, and they suffer from higher rates of heart disease, cancer, and diabetes than all other regions in the country.
Bottom line, when you talk about they need to go to the hospital, they need to go to the big city, even though that city might not be that big where the specialist is, it's going to be costly. And that cost, if they don't have an insurance card, is very threatening, very frightening, and intimidating.
My nephew got hit with a car the other day when he was going across 23 on his bicycle, and he got hit with the car, and he was pretty bad shape. They wouldn't even admit him. They wouldn't even try to help him in any way.
Rejection is commonplace here. Doctors are overloaded with Medicaid and Medicare patients and have less time for charity care. Now Cherie is sick and needs treatment. But with an outstanding bill from previous visits, her doctor won't see her.
Medical care does not just fall out of the sky. It is not free. It does not produce itself. Someone has to produce it and has to work very hard to produce it. So, really don't apologize for that.
Thomas Smith was Cherie's doctor.
Sir, my time is not free. Is yours free?
No.
Okay, neither is mine, sir. And I don't make any apology for that. I have children to feed. My time is not free to anyone. Unless I want it to be. If I want it to be, I'll give it to them freely.
You just don't walk into a doctor's office, though, and say, I have no insurance and I have no money. Will you see me anyway? I mean, chances are you are going to get denied.
Choosing between the needs of the poor and the financial realities of running a practice, physicians often find themselves on a collision course with the uninsured. For people without health insurance, there is only one option left, the public clinic. It handles only basic services, and most patients must travel many miles just to get here. But funding for these facilities is drying up.
We've heard about the safety net. I think that safety net has deteriorated. So, you know, the limitation of our resources as a provider, of the resources of the private provider, are critical to sort of conquering this battle, which I think it is, a battle of access and good quality access to the whole spectrum, from primary care and preventive care, even at a more elementary level, to the specialty care that every American should have the ability to receive.
I really wish you'd go.
Until that happens, people like Cherie and her family will continue to struggle.
There are those that do have difficulty, you know, coming up with the money to pay for some of the expensive tests that they run, and so a lot of people, they do without. They do without.
Public health facilities are closing all over rural America, but there is still a system of public hospitals in urban America. In Washington, D.C., that hospital is in the southeast corridor of the city. DC General was established and financed by Congress to care for the poor.
Jenny, please dial the MOIC desk 7518.
The hospital is legally obligated to treat all district residents regardless of their ability to pay. The homeless, criminals, the insane, and victims of violence.
Let's stick, come on.
William Hutchins is 15 years old.
Well, the story we got was that he was on the street. He heard some gunshots, felt a burning sensation in the back of his head, and put his hand to the back of his head and discovered that there was some blood there.
Lay back, lay back.
Dr. Elwood McGee is William's physician.
Well, I told him that he had been shot, did not know if the bullet was still in his head or to what degree of injury he had, but he had been shot.
All hospitals must treat victims of major trauma. But with the dramatic increase in violence, DC General has the busiest ER in the city, treating 2,400 cases last year.
Sing a little bit. Sing a little bit. Okay. All right, all right. Oh, so you were face to face? Yeah. I should start. Yeah.
Since 1983, Dr. Paul Oriafo has watched the violence escalate.
It changed from what it used to be. Oh, somebody comes in with injury inflicted by baseball bat, lead pipe. It became gunshot wounds, not just Saturday night specials, 9mm and Uzis, AK-47s. We did not become a trauma center as a status symbol. We became a trauma center as a matter of crisis, as a matter of dire need to the community that we serve.
Around the corner is the hospital waiting room. Up to 170 patients walk in every day. With expensive trauma care absorbing limited resources, basic medical services suffer. Some patients wait more than 12 hours just to see a doctor.
We're the safety net for the people in Southeast. People will come to us because they run out of prescription refills, because they can't afford to go see a doctor to get their prescriptions filled. They may come to us in the evening because they're working and they can't get to the hospital during the daytime to go to the clinic. So the emergency room winds up being the family doctor for the community as well. And it really puts a strain on us.
Inundated by the chronically ill and victims of trauma, DC General is breaking apart at the seams. With a third of all patients unable to pay their bills, the hospital has accumulated a 5-year deficit of $85 million. With the city going broke, DC General has cut 800 jobs, including 60 doctors. "12:30 a.m. William's condition becomes critical.
Looks like the bullet hit the bone, broke it, and in the process pushed the portion of the fractured skull up against the brain.
William requires brain surgery, which can run in excess of $100,000. With 80% of all victims of violence uninsured, the high costs of treatment are crippling public hospitals all over the country. 40% are predicted to shut down in the next decade. If DC General closes, transporting patients from this section of the city to the next nearest trauma center could prove fatal.
Those patients who come in here and within 10 to 15 minutes of getting here have to be on the operating table are the ones that will suffer. Not just suffer, the ones that will die. They come in here with no heartbeat. They're not breathing. They are pale, like a black man, pale, like a white sheet of paper. No blood in his system. Now you ride him on the ambulance for another 15 minutes going to the next trauma center. What do you get? You just take a carcass in there.
See, Mama can tell Mommy don't cry, because you're going to make him cry, Mom.
William and his family are lucky.
You okay? See, okay.
He will survive, and the city will pay for his care.
Cry, because you're going to make him stop crying.
With violence contributing to the hospital's mounting debt, some argue for rationing health care and against spending public money on kids who shoot each other.
It's extremely difficult to draw the line. I mean, to draw the line to me would be like saying, this person lives, this person dies, and I don't think we can do that.
How come?
The old saying is, nobody is God.
For 200 years, the public hospital has treated the poor, an entitlement mandated by government. But with competing market forces and dwindling resources, that system is now being dismantled. If the public hospital closes, the urban poor, like their counterparts in rural America, will have fewer and fewer places to go.
Considering the romanticized version of an ER that we all get from television each week, I wonder how prepared we are really for the kind of reality that we just saw. And Uwe, I wonder how prepared society really is to deal effectively with the unique